He is the chief medical officer of the National Football League, kind enough to call back in once again onto the Rich Eisen Show prior to an NFL season taking place in a pandemic. He is Dr. Alan Sills. How are you, Dr. Sills?
Hey, doing great, Rich. How are you this morning?
I am doing fine. We've got Bruce Arians coming on in about an hour's time. He announced yesterday that the Tampa Bay Buccaneers are 100% vaccinated. Do you have a number? Do you know how many teams there are who are 100% vaccinated and know what their vaccination rates are? Do you get a report for something like that, Dr. Sills?
Yeah, we do track that very carefully, Rich. And right now, today, around the league, we're at about 93% of all players being vaccinated. And that's even after the cut downs, which, of course, was one of the things we were tracking is there was some discussion about, as teams reduce their roster, that they might have a smaller percentage. But the percentage of vaccinated players is held right at 93%. And, of course, with our staff, it's virtually 100% that all our staff are vaccinated. So we're pleased with those numbers. Obviously, we're going to continue to work on them, and I'd love to see them continue to go up. But that's where we are as we approach the start of the season.
Do you know how many teams are actually 100% vaccinated, Dr. Sills?
I think there are two. I would want to just verify that. I think there are two. But, again, that's something that's changing every single day, Rich. We're still seeing teams that are having those conversations, having education, and seeing players step forward. So it's a very dynamic statistic. And I feel like we'll get to some others that do hit that milestone.
What do you do to get the 7% to take the jab here? I mean, what can you do? What is the message essentially to players who are still wondering?
I think it's just like we do with our patients in the office. I mean, Rich, I'm still a practicing physician, and so it's the same approach. You have patients who come in, they have questions, and you just need to walk through their concerns and share with them the data. I'm a big believer that no one ever gets shouted into belief about these types of issues. So I think it's about having a measured conversation and understanding their hesitancy and trying to address and show that data. And so, as I said, we continue to do that at the club level. I think it's also really important to have a trusted messenger, someone who's thought of as reliable and has a good grasp of the situation. And so that's going to be different for each individual and in each club. But as I said, those conversations are still ongoing, and I participated in a number of them myself. And again, that's not that different than what we're seeing in the rest of society. This is certainly not just an NFL issue.
That was my next question. Have you personally been reached out to by a player who is doing their fact-finding? We've heard players say they need more information. Has a player picked up the phone or asked for your number and called you?
Yes, multiple times. That's happened really over the course of the past few months, and I really enjoy those opportunities. Certainly, as I said, a lot of our team medical staffs engage in that, the NFL Players Association and their medical advisors. But I really, I've enjoyed those conversations because, again, players are just like patients. They want information. They want to have their questions addressed. And so that has been a part of my job over the past few months.
Dr. Alan Sills, the NFL's chief medical officer here on the Rich Eisen Show. How has the Delta variant changed the protocols and the approaches that you are attempting to put into place along with the Players Association?
Well, it's definitely changed the game a bit for us, Rich, in terms of how much more transmissible and the fact that it changes the symptom profile a bit, particularly in vaccinated individuals. So we're really doubling down and emphasizing the importance of symptom reporting. And I think that's an ongoing challenge, again, not just for the NFL, but the country as a whole. People that are vaccinated, if they get a little bit of nasal congestion or a sore throat, they don't always think of it as being COVID because they think, wow, I'm vaccinated, this must be something else. Maybe it's my allergies or I picked up a cold somewhere. So we've seen many of those cases turn into be COVID-positive cases simply because vaccinated people have milder disease. They don't have the same disease they had back in 2020. Last year when somebody was COVID-positive, they were unprotected. You saw high fevers and chills and loss of taste and smell and people that just really felt terrible for a few days to even longer. This year, again, if you're vaccinated, it tends to be much milder illness, shorter in duration as well, thankfully. And so it is a challenge to get people to speak up and say, hey, yeah, I want to get tested because, we do know that's one of our best methods for identifying infected individuals. If somebody with symptoms will walk forward and get tested. So we're doubling down on that. And again, that's not just a player issue. That's for staff and everyone in our environment.
So vaccinated members of a team, staff, players are going to get tested this fall, starting when? Like what? I know that it was once every 2 weeks. Is that going to be now once every week? because of the Delta
we
variant?
changed that cadence to once per week,
Right.
and we're dividing the pool of tested individuals into 3 different days so that we're testing multiple people over time, kind of getting a snapshot. And then we'll continue on with the daily testing of unvaccinated people. We also do daily testing of what we call targeted groups. So if someone is exposed, whether they're vaccinated or not, if they have a close exposure, a high-risk close contact to a case, we will test them daily as well for 5 days. And then, of course, anyone with symptoms, as we mentioned, or maybe someone that shares a household with someone that's currently infected, we're going to be testing them. So all told, we'll be testing over 1,000 people every day in the league. But the routine surveillance testing that you mentioned for vaccinated individuals, that'll be once per week for each person, unless they'd like to do more. They have the option to request a voluntary test more frequently, or if they have a high-risk person at home that they're concerned about, they can be tested anytime they request.
So if a player is vaccinated and is deemed to be a close contact of somebody on a Wednesday during an NFL week with a game coming on Sunday, what happens? Walk me through what happens for that vaccinated player.
For that vaccinated player, they're going to continue to come to the facility each day. They'll test on their way in.
Mm-hmm.
We will usually put them in a mask for the following 5 days whenever they are inside. And again, that's if they are a high-risk close contact. If we think they really had a substantial exposure to someone that's infected.
Mm-hmm.
We also do enhanced screening with them. So they have a personal interview each day. We go through a list of screening questions and make sure they haven't developed any symptoms. So there's additional testing, there's masking inside, and there's that screening process. And that continues on for 5 days for the testing and masking, 8 days for the screening process. But importantly, they're still allowed to come in the team facility, participate with the team, play in the game if that's relevant, as long as they don't have any signal on any of those items that we just mentioned.
Now, walk me through what happens with an unvaccinated player that is deemed to be a close contact on that Wednesday of a game day week. How is it different?
Yeah, if they're a high-risk close contact, they're essentially under the same protocols we had last year, Rich, 2020. And that's because we saw so many people who were not protected who had that high-risk exposure and then converted and became positive on testing. So if they're unvaccinated, they're actually out of the facility for 5 days. They will continue to test each day to make sure, obviously, that we don't detect any signal. But they're not allowed into the team environment. And again, that's strictly based on what we saw last year, where many of those individuals eventually turned positive. And if they did, it happened within that 5-day window of time.
So a vaccinated player who's deemed to be a close contact, high risk, as you mentioned, on a Wednesday has a shot to play on Sunday, but an unvaccinated player, that's it, out because it's a Wednesday and 5 days?
Exactly right.
Okay. So what do you say to somebody who will then come out and say that's unfair to the unvaccinated player? What do you say to somebody like that?
Well, again, all of our protocols are based strictly on one guiding principle, Rich, and that's trying to keep the team environment as safe as we possibly can. Last year and also this year, we said there are going to be positive cases. Again, whether they're among vaccinated or unvaccinated people, as long as this disease is endemic out in society, we're going to see some positive cases. What we're trying to do is identify them, keep them isolated, and mitigate the risk to everybody else in the building. So all of our protocols are strictly built around the idea of what works to keep the team safe. How do we keep the team safe? And certainly what we learned last year through our data was if you're unvaccinated and you have one of these high-risk exposures, again, we're not just talking about passing someone in the hallway. We're talking about a substantial amount of time you spent within a very defined distance with a positive individual. Your risk of converting and becoming positive is significant. And because of that, we don't want that person walking around in the building and potentially spreading this to others. So, again, our protocols are not about punishment or distinguishing people, based on choices. It's strictly what can we do to keep it as safe as we can for everybody involved.
Science, facts, basically is what you're saying.
That's exactly right. Yeah, we've taken the data and we've tried to let the data lead us. And the reality, Rich, is, the part that I didn't say is, if you're unvaccinated, you are at a higher risk. If you are unvaccinated and you get exposed, particularly to Delta, in a close manner, you have a really high risk of catching it. It's just very transmissible. So we're just trying to protect everyone, including the person who's exposed, but also, obviously, as I said, the larger team environment.
And then Dr. Alan Sills, NFL Chief Medical Officer, you are a neurosurgeon. As you said, you are a practicing doctor, as well as, just happen to be the Chief Medical Officer of the National Football League in 2021. So what I'd like to utilize this time, if you don't mind, to address some of the responses I've gotten when I have tweeted about, Instagrammed about, discussed on this show about my experience of being a breakthrough infection back in July and my desire to get everyone as vaccinated as possible so there are no more variants to pierce my vaccine, or heaven forbid what you read about might be coming out of the Southern Hemisphere, a vaccine-resistant strain, which is freaking me out, to be very honest with you. So what do you say to somebody who say masks don't work, Dr. Sills?
Well, again, you mentioned, Rich, I'm a surgeon. I've spent my life wearing a mask in the operating room, and we do that for one simple reason, because they do work. They reduce the risk of passing germs and infection to patients that we're operating on. So I think it's very clear that masks are effective in reducing many respiratory diseases. I mean, we've done the same thing for years with tuberculosis and influenza and a host of other diseases. I think what's challenging, of course, is masks work when they're worn properly, when they fit well, and when they're worn in the right environment. And that's always a challenge when you start applying that broadly. But again, I don't think anyone wants to go in and have a surgery done by someone who's not wearing a mask. I think that's probably would feel very odd and is a risk that most people don't want to take. So I think it's really, again, about what are the best mitigation measures for each situation and how we protect ourselves. But beyond the mask, Rich, what I would say to patients are the most effective tool we have right now are these vaccines. Most effective tool to keep us safe. And again, keeping us safe means preventing serious illness, hospitalization, and death. That's what the vaccines were designed to do. And by the way, that's what they're doing. I mean, they have a remarkable effectiveness in preventing serious illness and death. We spoke a couple of minutes ago that if you're vaccinated and you do test positive, it tends to be a very mild illness that's somewhat short-lived. That's very different than what we see in unvaccinated individuals. And so I think the data is very clear there. And the last thing I would tell you, Rich, is again, something you could talk to any critical care doctor or nurse. You just go to our hospitals nowadays. When you're at our hospitals, the people who are most ill, who are in the intensive care unit and who are struggling with severe illness are overwhelmingly unvaccinated. And so I think the data is very clear that these vaccines are doing what they were designed to do, which is preventing serious illness, hospitalization, and death.
Last time I had you on before last season, Dr. Sills, I was asking you all about the vaccines that I was hoping would be coming. And, you know, as we all know, they arrived with emergency usage approval from the FDA in December. And then we all know what's happened in 2021. What are you hearing about other variants? Are you hearing anything about that could clearly change the game for protocols in the middle of a season? What are you hearing about what I just mentioned? You read about vaccine-resistant variants. What's on your radar screen on that front, Dr.
Well,
Sills?
once again, we just go back to sort of our basic virology and other infectious diseases, Rich. And that's the nature of viral illnesses, that they will mutate and other strains will arrive. I mean, again, that's why we have different flu shots every year, because different strains of the flu arise. So that's really not unique to COVID-19. And so I think there will be other variants. It will develop over time, particularly as we have large areas of the world that are unvaccinated and unprotected, and the virus has a chance to mutate. But I just go back to saying that the data so far shows that the vaccines we have are still remarkably effective against all these variants, even Delta, which is so much more transmissible. The vaccine is doing a great job, again, preventing serious illness, hospitalization, and death. So I have a lot of confidence in the vaccines. As we've said for a league, we're always going to have to be flexible and adaptable. We're going to look at the data and see where it takes us as far as our protocols, and they likely will change. I mean, as you know, last year they changed throughout the season. They probably will again this year. But we'll do that based on what our data is telling us, what the science is leading us to, and doing what's safest for our entire team environment.
Dr. Sills, I appreciate the time. Thanks so much. Best of luck. I always ask folks in the NFL if they've got a target. They got something that they put on the grease board. Last year, a .08, if I'm not mistaken, positivity rate despite no vaccines. Is that's you want to beat that, right? That's what you're looking for in 2021.
Well, I think just to not get too far in the weeds, Rich, positivity rate probably the wrong measure this year. We're looking more at incidence rates, because we want to just see how many people potentially can be infected. But more importantly, we want to avoid that serious illness, hospitalization, death, keep our players, coaches, and staff safe and their families, and be able to get through our season. And I'm very optimistic about that. I think I've said publicly before, I think if our entire country was as vaccinated as the NFL is, we'd be in a far, far different place with this pandemic. So I hope that we can lead the way once again and show the benefits of vaccination and our ability to pursue some of the things we enjoy in life and go forward at the same time.
Thanks for the time, Dr. Alan Sills. Appreciate it.
Thank you. Have a great day.
That's Dr. Alan Sills, NFL Chief Medical Officer here on The Rich Eisen Show. Hey, you watched all the way to the end. Thanks for that. Watch more right here.